if in the competitive bidding process goes through and a large provider that's from outside the state gets a competitive bidding and they haven't been actively engaged in say, oxygen, for an example, that requires obviously a lot more technicalities than maybe some of the other equipment does. What's the process that the learning curve and the process, and to what extent, and obviously give me the Reader's Digest version, and to what extent from the patient side, from a health standpoint and quality of care, is someone who, is not, doesn't have the expertise that maybe your company would?
Well, first of all, Mr. Chairman, our company is 70 years old. It's independent, but we only entered oxygen probably about 8 years ago. The learning curve has been 7 for us. It's an exceptional amount of information that you must know. You must comprise an exceptional staff that's skilled in order to deliver oxygen. If you go as far as providing liquid oxygen, that's another step that you add to the process. The loss would certainly be to the patient. If you're being provided any type of medical equipment, let alone oxygen, by someone who doesn't understand the etiology of diagnosis, that doesn't understand what happens if they do not provide service immediately, the patient is going to suffer, and the ultimate result would be a hospitalization or at least a visit to the emergency room, which causes an increase to the CMS budget.
This is for Mr. Griffin, Mr. Stanfield. If the competitive business bidding process would continue, what would it actually do to your businesses? Mr. Stanfield?
My personal business in the Concord market, we would bid again based on our ability to serve, and we would bid a fair market price. It is unlikely that we would win that bid. We would simply exit those categories and try and survive with the rest of the business.
So you'd have layoffs.
It is impossible to subcontract. If you look at the contract price, which averaged 26% below current fees, what is the contract supplier going to pay me? It's already 26% below previous fees, and the offers that we had was 20% below the contract fee. Suppliers simply cannot subcontract under this process. So it would essentially take us out of the Medicare market for the product categories that we did not win a bid.
Mr. Griffin?
Very similar. I concur with Mr. Stanfield. We have already taken a little different approach, trying to work towards some categories, some product categories that are not included into the bid. In other words, we've gotten into the baby apnea monitoring business, a totally different field. We've gotten into diabetic shoes, totally apart from the Medicare competitive bidding process, not one of the product categories. A good portion of our business is retail. But, pardon me, once again, we've laid off 30% of our staff. We've exited that number of our staff just pure and simply because of that decline in business that we're foreseeing. We will bid again.
And Mr. Brandt, how about you?
Unfortunately, we would probably be forced to close because it affects 91% of the items that we put that we do. Even though they stated earlier that some items would be grandfathered in, enteral feeding supplies, diabetic supplies would not be grandfathered in, and most of our patients would cap within a few months for the majority of the business that we put out. So we could not rely on that. And when you don't win the bid, you can't pick up new equipment. You can't pick up new patients. So really, we would just be forced to close.
And Mr.
80% of our business is Medicare.
Well, I think it's a bit of a difficult question. Naturally, as a small business owner, my first concerns would be taking care of those who have committed to me to work for me. So I would say, I wouldn't want to say flippantly that I would just close the door. I think the net result, if we were to lose in certain categories, would severely impact our business. And as a business owner, I'd have to find other ways of adjusting for that revenue lost. Would that result in us closing? It's very possible.
Dr. Rautman, obviously you in your testimony you said you just started paying it out of your own pocket. I mean, that's quite alarming. But that says a lot about you as a person, that you go far and beyond the call of just being a doctor, that the quality of care of the patient. So I commend you of that.
Well, thank you, sir. I still have hope that I'll get my DMEPOS supplier number. I've been told that they have 40 or 50 more days to answer my last application. I've probably applied 6 times in the last year. But if I don't get the supplier number, I'll have to stop providing that service to Medicare patients. And then patients who need those devices will be on their own once they leave my office to try to find those devices either in the marketplace or struggle to find them somehow. And my concern is they'll find the wrong equipment or they won't be able to find what they need. There'll be delays that might cause delays in their healing or untoward complications.
And not to get off on a completely different subject, but the cap, how much did it play in your bidding process?
Which cap? The oxygen cap?
Oxygen cap. What did it pay in your, in your bidding process? I mean, did you take that in consideration?
We did. We took it into consideration, considering that we knew that January 1st there was going to be a change in reimbursement. It did not make sense to bid at a lower rate, knowing that we were already going to take a significant cut on the 1st of January. If I might add, there's another piece of this. One of the things that occurred in our market was Mr. Wilson talked about assuring that service continued for oxygen patients, and it was perhaps more important than a hospital bed. Yet there were cases where hospital beds, in fact, kept people in hospital for extra days at a very high cost to Medicare, because under the bid there was no one available that could deliver a hospital bed within a short period of time to facilitate a discharge.
If I may, one of the things in the Polk County demonstration project is that it was before the legislation of the cap. So people bid in Polk County knowing that oxygen would continue to be paid, but here it began, we knew that we'd be capped out 6 months after the program started, so it definitely had an effect on how we bid.